Hey, it's Eric Hultgren, and welcome to another episode of the podcast. On this episode, we're talking to Dr. Steven Zonca from Muskegon Surgical Associates, and we're talking about what patients can expect when they come into the office now that Michigan is opening up, and some of the hottest trends in plastic surgery and aesthetics as we're in the middle of the summer. I hope you enjoyed this episode of the podcast. Dr. Zonca, how are you, my friend?
I'm doing great, Eric. Thanks for having us on.
Thank you so much for joining us. So, we're obviously in a strange time, as all businesses are right now. But before we talk about what you guys are doing right this very second, I want to go back a little bit for people who might not know you. And can you talk about maybe your trajectory and how you got involved in plastic surgery? And then I want to ask you some questions about board certification, because I know how important that is, and I want people to understand why it's important. But how did you get your start, and how did you get here?
So I'm a plastic surgeon, and I've been here in Muskegon for along the lakeshore for 18 years. I originally started my surgical training in Detroit, where I did my general surgery, and then I went on to do a plastics fellowship. So people who are board certified, physicians who are board certified, have been through a training program, and they've passed a series of written and oral exams and have to maintain that certification through continuing education and periodic examinations. So that's really important, because there are people out there who are physicians, but they may be simply a family practice doctor or otherwise, and have no surgical training and can call themselves a cosmetic surgeon because there is no board of cosmetic surgery. There are several boards out there where you simply pay a $150 fee and you can be a board certified, be on the board of a specialty. The American Society of Plastic Surgeons, which we're all members of, requires board certification here by the American Board of Plastic Surgery. So it requires that you have had surgical training in plastic surgery as well as pass the board certification process. So it separates out people who have had true training and people who, for example, might just dabble in something aesthetically.
And this art of medicine is very complex. I mean, some of the things that you guys offer require a level of expertise and skill that, to use your words, you can't dabble in facial reconstruction, right? Like, that's a thing that you actually have to have a firm grasp on how that happens.
We have seen physicians who are non-surgeons create problems for patients not without the adequate background and training. And like many challenging medical issues, there are more than one way to address a problem. But if you're only familiar with one tool, if your only tool is a hammer, the whole world looks like a nail. But there's sometimes when you need a screwdriver or a wrench to tackle a problem. And so having a broad base in training in plastic surgery gives us all the tools we need to be able to handle not only routine things, but the more challenging processes. And it also, there are people who are certainly great candidates for things like Botox and facial fillers. There are also people who would benefit from something like a laser or surgical intervention, and someone who doesn't have that full spectrum of knowledge and training to be able to offer that, again, their whole world looks like a nail.
Dr. Zonca is joining us, and we've obviously touched on, in a current COVID-19 world, the way in which we interact with our guests or our patients has obviously changed. And as people are coming in to see you guys, what can they expect now that most of what you guys are able to do, I think all of what you're able to do, has opened up as of yesterday, but what can they expect when they come into the office?
Sure. Like many places, we ask that you wear a mask when you come in for your appointment. We will ask you a few screening questions about illness symptoms at the door, and check your temperature. And that goes for not only the plastic surgery side of our office, but our general surgeons and our vascular surgeons also. We're additionally limiting family members who accompany you to your appointment to essential people to provide the treatment, so we can limit the number of people in the office to allow for more social distancing and spacing. Our spa clients will actually check in and then wait in their car or outside. It's beautiful this time of year, so they
Right.
can wait.
Right.
But we'll actually call you in when we're ready for your spa appointment. Again, it's just trying to minimize the number of people in a closed area. Even though we've got a nice spacious waiting room, we're still trying to keep people spaced out as much as possible.
And so, Dr. Zonca, how is the staff doing? It's one of the questions I've been asking everybody I've been interviewing. Like, how are you guys doing? Because this is obviously a stress on consumers as they try and navigate the world. But you guys, you will meet people who will be like, I don't want to wear a mask as I go into the coffee shop, and that's like 5 minutes. But with some of your staff, they might be wearing masks the entire day. So, like, mentally, how's the team doing?
Actually, our team is doing great. We're for many of our procedures in the office, we wear a mask for an extended period of time, and so this isn't anything completely foreign for many of our staff, especially on the nursing side. And our staff is happy to be back at taking care of patients, and there's certainly some extra procedures in place. Like I said, the screening at the door, and I think everyone we really enjoy what we do as far as taking care of people and people we have relationships with built over many years of seeing them. And so I personally really enjoy being back taking care of people. It was a very strange time for everyone when we were just seeing emergency things at the hospital and really limiting what we did. So, and on that same line, we would encourage people who have maybe had a mammogram that was canceled during this time, or a colonoscopy, or a skin cancer screening with us, or a vascular ultrasound screening. If that was either canceled or rescheduled because of the shutdown, we would encourage you to contact us, and we would be happy to set that up. Or even if you're not a patient of ours, we can help coordinate things like a mammogram for you, because those are really important screening tools to find potentially serious problems in advance, or where they're still in a very treatable stage. We've certainly, talking with my general surgery colleagues, they've had an increase in the number of really bad gallbladder disease come in because of the shutdown, and people were worried about going into the hospital, that they have maybe put off seeking treatment. And so I would encourage people who have been having symptoms like upper abdominal pain after eating fatty foods to contact us for a general surgery referral, so that we can help you take care of that in advance of a major problem. As far as the hospitals, also, the hospitals are doing a great job of screening people at the door. People who are having surgery are being screened for the coronavirus testing, and so that we make sure that we know if anyone has the virus, that they are isolated before they get to the hospital. And so the hospital is back open and taking care of patients very safely. And so if you have any concerns, please don't hesitate to go into the emergency room or to seek treatment at a hospital if you need that.
Yeah, I was just going to hit on that, Dr. Zonca, because I know that the medical community is frustrated by that, and that people are staying home because they're worried about an interaction happening. So you're seeing these things kind of pop up when they could have been sort of tackled earlier than before they became catastrophic.
It's certainly we have seen that in our treatment arena. People who maybe had a little infection that turned into an abscess that could have been maybe treated with just antibiotics now are requiring incision and drainage, or more aggressive things when it possibly could have been treated with just antibiotics, or a minor procedure had it been treated in a more timely fashion. And we understand there's some concern, but at this point, both in the office and in the hospital, there are excellent protocols in place to keep people safe. And we have enhanced cleaning protocols within our office. All our staff go through screening. All the staff at the hospital go through screening, and there's an enhanced cleaning process in the hospital also.
All right, so we're in some Michiganders, lots of Michiganders' favorite time of the year being summer, and people are getting used to summer as we've been coming out of being sheltered in place. So for you guys, what are some hot treatments going on, not only in the plastic side, but the aesthetic side, right? The skincare side. What are some things that you are seeing a lot of right now that you typically do as we're heading into the summer, or I guess should say in the summer?
So certainly Botox, Dysport, Xeomin are our neurotoxins, and those are very popular. Uh, Everyone wants to look great, and they are able to erase the frown lines from your face, and those are very popular. And just like people who have been unable to get a haircut for the last couple of months, those are great things to make you feel and look your best. Facial fillers are also very popular right now. Again, it's a non-surgical lift to the face to soften fine lines and plump up cheeks, and those are really very popular right now. Coolsculpting is another non-surgical treatment that we do right in the office. Coolsculpting freezes the fatty tissue to help you look your best, getting ready for beach body and pool season. So there's no downtime with the Coolsculpting, and it literally freezes the fat so it goes away.
Very cool. Very cool. Yeah, I've seen cool sculpting. It's a very cool process. So the last thing I want to ask you is for people who are watching this as they're getting out in the sun, and what's different, I feel, as any other year is that we've been inside cooped up for a long time, so we might sort of forget the habits that we need to make sure that we're protecting our skin when we're out. Could you give us some tips on ways in which we can protect our skin when we're out in the summer sun, especially when temperature-wise, it's sort of been up and down. Like when it gets hot, it feels like, oh, I should put sunscreen on. But when it's 70 and comfortable, you tend to forget that stuff.
Absolutely. Sunscreen is a great protection for our skin to prevent skin cancers as well as the signs of facial aging. Protective clothing, such as, for example, a wide-brimmed hat or, the swimwear shirts that, for example, if you're going to be out in the water, we find that water activities tend to wash off a lot of sunscreens, even the waterproof sunscreens. And so for people who are going to be out doing water sports or out at the beach, I do recommend the swim shirts that have SPF built into them because that doesn't wash off. There is no question that sun damage can lead to skin cancers of the face and arms. Those are the common areas we see it. Those are the areas that get the most sun. So sunblock is always recommended, or some type of protective clothing. We don't want you to live in fear of the sun. We want you to get out and enjoy this beautiful weather we're having, but just make common sense decisions that even on a 70-degree day and a partly cloudy, you still get significant sun damage if you're going to be out throughout the day.
Dr. Steven Zonca, thank you so much for your time today. I hope you and your staff remain healthy and safe, and we will talk to you next time.
Thank you, Eric. Have a good afternoon.